Healthcare. Everybody wants it, not everybody gets it. Dr. Rose Zacharias is the president of the Ontario Medical Association. She's a medical doctor. She joins me right now because everybody knows there's a problem in every province across Canada. And what's to be done about it? It's not just putting in billions of dollars and building more hospitals, or is it?
So we couldn't have seen a global pandemic coming.
Yes.
That has strained, and it's no one's fault, but that has strained the healthcare system.
It's made it worse, but we had a problem before then, didn't we?
We did have some gaps in the healthcare system prior, absolutely, that I think we were patching up with Band-Aids. And now those gaps have been exposed.
Right. So what has to be done? Is it just simply a case of pouring in millions of dollars? Billions.
I'd like to focus on the backbone of healthcare delivery, and that's primary care,
right,
so that everyone would have access to a family doctor, nurse practitioner. Right now in Ontario, over 1 million people don't have access. And so they come to emergency departments that are open 24/7 or to walk-in clinics, and they don't have that trusted relationship with a doctor that can help them navigate the system and care for them with their medical conditions.
What happened? Why is it that, we had a population explosion? Is that why we don't have enough doctors?
Well, right now we don't have enough doctors, and we need to address it. So we do welcome the announcement to increase the medical student spots, to reduce the barriers for doctors who are qualified to practice in Ontario but don't have a license yet to practice in Ontario.
Right.
And the administrative burden and tasks on doctors have taken them away from the bedside, away from the direct face-to-face with the patient, and are preoccupying them elsewhere.
Now, I've heard from doctors, just anecdotally, they said, years ago, even as much as 30 years ago, there'd be 2 or 3 or 4 administrators per hospital, and now there's 300 or 400 per hospital. And there's 2 or 3 people they would deal with in the ministry, and now there's more and more bureaucrats. Have we become over-bureaucratized?
One thing that the pandemic has ushered in is a massive backlog of surgeries and procedures. Right. And so we do need some guidance as to how to get doctors, surgeons at the bedside and catching up on the 22 million patient care services that were backlogged as a result of the crisis of COVID.
Well, but bureaucrats aren't going to do that. Is the OMA going to do that? Are you dealing with the bureaucrats at Queen's Park to say, we got to cut this out?
We're committed to working with government, absolutely. People trust their doctors, and they should.
Yes.
Our first and really only priority is patient care. We are interested in developing that relationship and to guide a patient through healthcare choices in order to live their best and most healthy, functioning life. And so we are committed to working with government inside a publicly funded healthcare system so that good choices and urgent solutions right now can be implemented.
Dr. Zacharias, thank you very much. I'm going to ask you back in 6 months. I want to see how you're doing in that. I'm sure it's going to be good news. Thank you.
Thank you.
3 minutes. Please stay tuned to keep informed about the latest policy issues. We all need to sharpen our game, because if we don't, we could end up with another Justin Trudeau government, and we don't want that. So please subscribe, tell your friends about the show, and if you can, PayPal, because that guy behind there, he wants to get paid. He does a very good job.